Hi, today we'd like to continue on the series of PCOS, talking about why certain things happen, why certain couples cannot get pregnancy or they experience miscarriage with PCOS. Today's topic we are talking about PCOS and infertility as to why it happens to these patients. Now, these couples, people who have PCOS, who later on find out that they are actually having infertility, struggling with pregnancy, in the early days, they do not put any emphasis on the treatment of PCOS because they do not believe PCOS to be something severe. Because of how common it is, they believe that PCOS might not be that dangerous or it might not cause any complications because right now life is good. The only thing that they experience is that a little bit of physical symptoms that you can have managed with certain medication such as oral contraceptives, the most common ones, Diane 35. Some will even go for traditional medication, traditional Chinese medication specifically, or other herbal medications to treat this PCOS. But they don't really think that it's something that big of a deal, and they go on with their life without seeking proper diagnosis and treatment. And the only thing that they experience is that they may skip their periods once in a while. But they only start to become more anxious and actually put more emphasis after being married, when they are actually trying to conceive. Now, when these types of couples try to conceive for over a year or two with no successful pregnancy, they are unable to get pregnant. Now they get nervous. Now they go for the proper diagnosis and treatment of PCOS. Once they reach to the doctor's office, go for proper diagnosis, then they find out they're diagnosed with PCOS. In fact, they already know early on. That is what's causing this problem now. So why exactly are these couples facing infertility because of PCOS? It's because PCOS is a condition where there is testicular tissue abnormally present within the ovaries. Now it can cause obstruction in ovulation, which means ovulation there will be problems. This patient will not be able to ovulate normally. They may need more time for the follicles to mature, or they may not even ovulate at all. Furthermore, even if they do manage to ovulate, these egg cells are of lower quality because at the end of the day, this is a disorder of the ovaries. The ovaries are abnormal and unhealthy, causing unhealthy egg cells as well. So even if they do ovulate, even if they do fuse together with the sperm cell, this is a highly high risk or unstable pregnancy that can quickly end. Or as these patients are experiencing, they do not even experience any pregnancy. Furthermore, another thing that can make it worse is that 50% of PCOS patients have another underlying condition that is happening side by side alongside with this PCOS, which is a form of uterine malformations. For example, these patients may have some form of a septate or a naive uterus, the most commonly present ones that we observe over the past 2 decades here at Antai Hospital. So it makes it much more complicated now. It's getting much more difficult to get pregnant and sustain a pregnancy now because first of all, you already have an ovulation disorder, a disorder of the ovaries. Now you have a problem with the uterus now. Even if you manage to ovulate and the zygote forms, it implants, presence of this naive uterus, a septate uterus will cause recurrent miscarriage or even worse, infertility. It can also lead to ectopic pregnancies as well. So instead of going for all these oral contraceptives and traditional medication, first of all, you need to seek early diagnosis. That is what we always put emphasis on PCOS because it is a highly treatable condition, especially early on. When you detect it early on, it's much more effective and you can sustain healthy pregnancies. You are still able to get pregnant and you can ovulate monthly, regularly. You don't need to see any delay and you won't struggle getting pregnant. At Antai Hospital, what we offer you is a highly effective surgical treatment. In fact, PCOS is believed to be untreatable But at Antai Hospital, we can have it treated for you, and simply we use 3D laparoscopic surgery, a rather straightforward surgery, simple, that we just simply remove the present abnormal tissue within your ovaries, the testicular tissues. And if we diagnose if there's a presence of a naive uterus or septate uterus, then we need to give you another surgery, which is a corrective surgery. We need to correct the shape and size of the uterus. Once we've solved the problem with the PCOS, we solve the problem with the uterus, whether it's a naive uterus or septate uterus. If these two problems are solved, then infertility will be no more. There will be no more recurrent miscarriage. Many times these patients, they only solve one problem and not the other, and they believe treatment is ineffective. It's because there is no proper full diagnosis. So at Antai Hospital, we need to treat both conditions, and then we can ensure that you will have a healthy, successful pregnancy. And this treatment is offered to you with a full refund guarantee. If you are still unable to sustain a full-term pregnancy and get pregnant in your next attempt in conceiving after receiving treatment with us, then we will be obligated to refund you the full treatment costs. So please get in touch with us via the website. Please do not delay anymore, especially when you're trying to conceive and if you're at an advanced stage. Get in touch with us as soon as you can, and let's discuss how we can help you on your journey today.